If you or someone you love has just been prescribed radiation therapy, there's a really good chance you're feeling a sense of overwhelming, quiet dread right now. You are absolutely not alone in that. As the lead narrative engine for the RadioTherapy India project, my entire goal today is to replace that fear with hard, evidence-based hope. We're going to look closely at the clinical data, break down the actual physics, and explain exactly how modern radiation therapy works. So let's jump right in and bust some of the most damaging myths in cancer care today.
We have to start by confronting the elephant in the room. It's that terrifying rumor, often sparked by well-meaning neighbors or random WhatsApp forwards, that a radiation beam is somehow going to shatter a tumor and scatter malignant seeds all throughout your body. And honestly, the fear is entirely understandable, right? The word radiation sounds dangerous. It feels completely intuitive to worry that pointing a powerful energy beam at a tumor might shake those cancer cells loose, send them flying through your bloodstream, and make the disease explode across your body. But we really need to look at what the global evidence actually tells us about this.
There is a massive, stark contrast between the whispered myth and the actual biological reality. The WhatsApp myth basically envisions radiation as this blunt hammer. But radiation is not a hammer at all. It is a highly sophisticated, localized treatment. When it's given at curative, or what we call ablative doses, the radiation completely destroys the DNA of the cancer cells. A really comprehensive review by Vilalta and colleagues, published in Cellular and Molecular Life Sciences back in 2016, confirmed that radiation is fundamentally an anti-proliferative agent. When cells are destroyed by these curative doses of radiation, they're dead. And the simple physical truth of the matter is that dead cells literally cannot migrate. They can't invade healthy tissue, and they absolutely cannot seed new tumors.
So, you're probably wondering, if dead cells can't move, why do some people firmly believe their cancer spread after radiation? Well, this brings us to a really crucial biological concept known as microscopic metastases. Cancer is often a systemic disease. A lot of times, patients already have these microscopic clusters of cancer cells in places like their lungs or bones at the exact time they are diagnosed. These clusters are so unbelievably tiny that even our most advanced CT, MRI, and PET scans physically cannot detect them yet. So when the radiation successfully controls that primary local tumor, the patient lives long enough for these pre-existing, distant micrometastases to grow large enough to finally show up on a follow-up scan. It creates this heartbreaking illusion that the radiation somehow caused the spread. But in reality, that systemic disease was already in motion long before the very first dose of radiation was ever delivered. It's just the natural progression of the disease, not a failure of the local radiation treatment.
To really understand why radiation doesn't just smash into tumors like a hammer, you have to look at our modern tech arsenal. In the 1970s, sure, radiation used these broad, blunt beams. But today, our machines are absolute marvels of precision. Take intensity-modulated radiation therapy, or IMRT, for example. The radiation beam is actually broken up into thousands of tiny little beamlets, and the intensity of each individual beamlet is constantly adjusted. Radiation oncologists use incredibly sophisticated computer software to literally sculpt the radiation around the healthy tissue. It eradicates the tumor with absolute precision, all while safely hugging the contours of your vital organs.
Knowing we have this level of precision should build a profound sense of hope. And here's the best part. This world-class infrastructure is readily accessible right here in India, empowering you to stop cancer right in its tracks. First, as we mentioned, IMRT shapes the dose to the exact contours of your tumor. Second, we have IGRT, which stands for Image-Guided Radiation Therapy. This uses real-time imaging, almost like taking a mini CT scan right there in the treatment room, to verify the tumor's exact position every single day, correcting for even millimeter-level movements caused by something as simple as you taking a breath. Finally, SBRT, or Stereotactic Body Radiation Therapy, allows us to deliver incredibly powerful ablative doses in just a few rapid sessions. Your treatment is pinpoint accurate, highly effective, and entirely non-invasive. You won't feel the beams, and no, you won't be radioactive afterward.
We really have to trust the physics, and we have to trust the evidence pack. A massive meta-analysis of over 42,000 patients across 78 trials, conducted by the Early Breast Cancer Trialists Collaborative Group and published in The Lancet in 2011, proved beyond a shadow of a doubt that radiation significantly reduces local recurrence. In fact, it prevents 1 breast cancer death for every 4 local recurrences avoided. On top of that, an analysis of over 1 million UK patient records from the 40 Project, published in the British Journal of Radiology, showed that radiation contributes to roughly 40% of all global cancer cures. Just think about that. Over 50% of all cancer patients worldwide will receive radiation. It is a vital cornerstone of modern oncology, absolutely not a last resort.
Shifting gears to another incredible modality, let's talk about brachytherapy. I like to think of this as internal healing. Unlike external beam radiation, which has to travel through the body to reach its target, brachytherapy places customized radioactive seeds or sources directly inside or immediately right next to the tumor itself. Because the radiation source is placed directly at the site, it only has to travel a very, very short distance. This allows the medical team to deliver an extremely high, concentrated dose of radiation precisely where the cancer is, maximizing the destruction of the tumor while beautifully preserving the healthy tissue all around it.
This pinpoint the internal approach is just so vital for the hope narrative, because the radioactive sources are placed inside the tumor. They move seamlessly right along with the tumor if you happen to move. This achieves what we call incredibly high dose conformity. But what does this actually mean for you? Well, it means a heavily enhanced chance of a cure, but just as importantly, it completely prioritizes your quality of life. By sparing the surrounding healthy tissue, brachytherapy preserves your organ function. Whether it's for gynecological tumors, prostate cancer, or breast cancer, these treatments are custom-tailored to your exact anatomy. It really is a perfect example of academic medicine working to preserve both your dignity and your life.
Now, we need to transparently address another long-term fear that comes up a lot: secondary malignancies. A huge source of the radiation causes cancer myth is actually just a misunderstanding of radiation-induced secondary cancers. This is not the original cancer spreading. It's a completely new, independent malignancy that can sometimes arise years and years later. But we absolutely must keep the numbers in perspective here. According to a 2016 study by Comran and colleagues in the journal Cancer, only about 8% of second cancers in adults are actually related to radiotherapy. The overall risk is generally estimated at less than 1% for most adults, and it usually takes 10 to 20 years to potentially develop. If you are an adult receiving radiation today, the immediate life-threatening danger of your current tumor vastly outweighs this small theoretical risk decades down the line.
The comprehensive data shows us a really hard truth. The actual danger isn't the radiation. The real danger is delaying complete curative treatment because of WhatsApp myths and neighborhood rumors. Pushing desperate families toward unproven natural cures offers nothing but false hope, all while the real disease quietly continues to advance. Furthermore, historical data clearly reveals that when radiation doses are too low, or when treatment is left incomplete, tumors can persist and then they have the potential to spread. So incomplete treatment is the actual risk here. You absolutely must finish your prescribed course with the curative doses that your doctors calculated precisely for your specific tumor.
I really want to empower you to take an active role in your own healing. So I want you to take this consultation guide straight to your radiation oncologist, who, by the way, you should truly view as the architect of your cure. Ask them these 3 key questions. First, is my treatment aim curative, meaning ablative, or is it palliative? Second, how will modern techniques like IMRT or brachytherapy be used to protect my healthy organs and maintain my quality of life? And third, what is our long-term plan to monitor for any pre-existing microscopic disease? Having this structured, open conversation is going to replace your fear with cognitive clarity and give you a very clear path forward.
Trust the physics. Trust the evidence. Modern radiation therapy does not spread cancer, it stops it. So as you get ready for your next appointment, ask yourself, are you going to let neighborhood fear dictate your journey, or will you step into that clinic armed with the truth? This explainer is for educational purposes. Always consult your radiation oncologist for personalized medical advice. Part of the RadioTherapy India project. Visit us at radiotherapyindia.org or contact us at contact@radiotherapyindia.org to learn more and connect with top experts. You can also join our Telegram at t.m/radiotherapyindia or listen to the full details on Spotify. Thank you so much for learning with us today.